Begin with that breaking news. Steward Health Care has filed for bankruptcy. I'm Latoya Edwards.
And I'm Raul Martinez. Steward Health Care has a number of hospitals here in the Bay State. So the big question is, what's next?
That's right. Let's send it to NBC 10's Alicia Palumbo live in Dorchester. Alicia, what do we know this morning?
Well, good morning, Latoya and Raul. The biggest thing for patients to know is that Steward hospitals across the state and across this country remain open, and state healthcare leaders here in Massachusetts say that patients should not hesitate to seek care at these hospitals, including right here at Kearney Hospital in Dorchester. Now, this bankruptcy filing does not come as a shock to many. In fact, over the past few days, the Healy administration activated an emergency operations plan in response to Steward Health Care's serious financial problems that came to light months ago. That plan includes a command center to monitor all Steward locations in the state and manage the potential fallout of a bankruptcy filing. Now that Steward has filed for Chapter 11, the healthcare company said on its website that restructuring is in the best interests of its patients, physicians, employees, and communities at this time. Steward has 32 hospitals in 8 states, including 8 right here in Massachusetts. It blamed its financial problems on the, quote, highly challenging healthcare environment. That includes insufficient government reimbursement, skyrocketing labor costs, inflation, and impacts from the pandemic, according to Steward. Now, Steward reportedly owes hundreds of millions of dollars in unpaid rent and has been sued by at least 24 vendors who claim they weren't paid for services or supplies. In a statement, Steward CEO said under the bankruptcy process, Steward will be better positioned to responsibly transition ownership of its Massachusetts-based hospitals, keeping all of its hospitals open to treat patients and ensure the continued care and service of our patients and our communities. Health and Human Services Secretary Kate Walsh said the Healy-Driscoll administration is working with Steward and any potential partners to support an orderly transfer of ownership that protects access to care, preserves jobs, and stabilizes our health care system. Now, what remains unclear at this point is who might take over the hospitals here in Massachusetts. We're live in Dorchester. Alicia Palumbo, NBC 10 Boston.